Tax hikes kicking in, job cuts, well, piling up. The president claiming we really don't have a spending problem in this country. What a week. Now the flu is threatening to make an already sick economy even weaker. Dr. Sreedhar Potarazu and we've got business owner Toma Brascia here on the medical and financial hit, respectively. Doctor, to you first. How bad does this get?
This bug is going to cost big bucks. The last time we had a flu epidemic like this, it cost us about $100 million in lost days, $7 billion in lost compensation, and the CDC is projecting that just the direct medical costs alone from this flu epidemic could cost over $10 billion. All
right, you're talking about the Center for Disease Control, but I want to know, why is it so bad, Doctor, before I go to Toma? Why is it as bad as it is? Are these shots not working? Is it a different strand of flu that's grown? What?
Yeah. A couple of things is that this particular flu strain, H3N2, is associated with more complications than previous strains of the flu. Sometimes people who initially have flu symptoms and then actually get worse a couple of days later may have a superimposed bacterial infection. The second reason is that even though there is, relative availability of the flu shot, there's still about only 46% of the people that actually got the shot. So there's obviously a huge number of people out there that have yet to actually get the flu shot. It's not too late. It takes a couple of weeks still to kick in.
Yeah.
But these are the things that really have a big impact in terms of how early and how significant this epidemic is.
Toma, what do people do then? I imagine like establishments that have people, where a lot of people go, restaurants, theaters, people might be a little bit more averse to going there, and it cascades. What are you noticing, seeing, reporting?
Well, in our hotels, we're noticing some drop-off in groups that are coming in, corporate groups. And in some of my retail establishment, and notice some people are coming in. I have a cigar store. They're coming in and buying the cigars, but they're not hanging around in the lounge to smoke them. They're rushing out. So we've spent a lot of time being concerned about not being letting the contagious disease spread by disinfecting everything we can in the hotel constantly, water fountains, handles.
What do you tell your people, Toma? There's a mixed bag on, some of them are afraid to come into work, but obviously if they come into work and they sicken more people if they're sick, it's a double-edged sword. What is your advice to your staff?
We advise our staff that if they feel like they're sick, to stay home.
All right, Doctor. Not everyone's seizing on that, though, right? I mean, a lot of people are afraid for their own job security. So, Doctor, what do you tell people? Put the job security to the side? What?
I tell them about the 3 H's. The first is hand washing. I think the remarkable statistic is we touch our face about a couple of 100 times a day, and that's how the germs spread. The second H is stay home, and the third H is hydrate. Keep drinking. And the fourth H is don't shake your hands. I've been traveling a lot, as I'm sure you do, Neil, and the hygiene on escalators and in airplanes is horrendous. That's where the germs are spreading, in these large crowds where the conditions are really horrible. So staying home is really key because, as we all know as employers and otherwise, this will spread fast.
Is that a good policy, Tom? I mean, you hear a lot of business guys say, you could skip the handshake now. We'll just nod when you come in, or a business acquaintance comes in. Has it gotten that bad?
Yeah, we actually in some of our hotels now, the staff, instead of shaking hands when they did, they'll do a fist bump.
Well, that's probably a good attitude to have.
And we're encouraging all of our managers and as many people as possible to get flu shots now if they haven't gotten them. We saw a piece on your sister station, Fox News, Monday, and we pulled the clip out of Dr. Siegel giving Megyn Kelly a flu shot on air. And we said if it's good enough for network personnel, it's good enough for our people to continue to get flu shots now.
I wanted to have Dr. Siegel on and give him a flu shot myself.
Yeah, he tried to give it to give it to Varney this morning, but Varney said he doesn't want one.
So the doctor is kind of a slippery character in that regard. Guys, thank you both very, very much. Good advice from both of you. We appreciate it.